built on some fundamental misunderstandings of how drug development works. The law relies on price controls that we've seen in other markets that have really abandoned the life science sector to aggressively drive down costs for the government, but not necessarily for patients. It also encourages drug makers to stop looking for new applications of existing drugs through post-approval research or secondary indications for orphan drugs. At first, it began with one company announcing that it's going to hold off on a phase 3 pivotal study for a medicine for a rare disease that has no other treatment options. After that, we've seen a dozen or more companies, brand name companies that are in your medicine cabinet today, to small biotechs that you've probably never heard of and treat rare disorders. All of them announced in their Q3 earnings that they really are changing their plans as it relates to research and development. The most urgent fix from our perspective is certainly undoing what we call the small molecule penalty. The legislation really kicks in these price controls for small molecules after 9 years and 13 years after biologics. Because Congress has shifted the rewards to these large molecules, we know that we're gonna see less and less investment in the small molecule products, despite all the promise that they have. But we also know this secondary indication disincentive is playing a huge role. This legislation punishes pursuing secondary indications. And that's something we would like to see fixed right away. At the end of the day, a clinical trial to a patient community that has no treatment is hope embodied. And when they then see these clinical trials have to be put on hold because of the failures of this legislation, we're taking that hope away from the patient community.